Hello ladies, this is Dr. Jess from InSync Medical. I'm going to give you today the lowdown on what happens during your regular cervical cancer screening. I'm referring to your regular pap smears. Now, pap smears are meant to be done at the very minimal once every 3 years. Now, if you combine a pap smear with what we call a HPV test, and a HPV test refers to a human papilloma virus test, then the beauty is you only do them one time every 5 years. So let me tell you what exactly happens during a pap smear test. Many women do avoid it because they're embarrassed, they feel that it's going to be painful or extremely uncomfortable. It should not be the case. If you're more aware of what goes on during the pap smear and the tips and tricks of how to make it more comfortable for yourself, this could be quite an uneventful process for you. So step 1, practically you enter your doctor's clinic. Step 2, the doctor will get you to lie back on either a gynae chair or on a crop standard flat bed. Step 3, your doctor will tell you to get undressed, of course, to remove just your bottoms and your underwear. You will need a proper exposure of your vulva so that the vaginal opening can be seen very clearly to get easy and comfortable access into your vaginal canal. So don't keep your underwear strapped around your ankles. Please have them removed completely so that this whole process is far more comfortable for you. Now, step 4, what happens here is that the doctors will apply a little bit of lubricant on a device called a speculum. So the speculum is then very gently inserted into your vaginal canal. And once it is inside your vaginal canal, the speculum has got 2 little beaks to it and it will be opened up. And once it is opened up, you actually can see the inside of your vaginal canal and you will see the cervix at the end of it. Your doctor might then tell you that he's going to open up the speculum. So when he opens up the speculum, it's obviously occupying some space in your vagina and you might feel a sense of fullness or a sense of stretch within your vagina. Now, when he actually gets down to doing the pap smear, he uses a brush, something like this, and this brush is used to enter the vaginal canal, and we put it right into the hole that we see at the cervix. And a couple of little spins are done to collect some sample. Some girls do experience a little bit of a tugging sensation. I kind of call it like a very gentle yucky sort of feeling, but it's over with within seconds. So once the samples are collected, your doctor's out of there, the brush is taken out of your vaginal canal, the speculum is then closed and moved out of your vaginal canal, and essentially your pap smear is over. What can you expect right after that? I do often warn my patients that, hey, you might have a little bit of pinkish staining or a little bit of bleeding right after the pap smear. And sometimes as the doctors remove the brush from the canal, this brush might come into your side and you might note that there is some blood on it. Don't be too frightened. It's absolutely normal because we have rubbed against your cervix and surely there's just a little bit of friction that's going to cause a small amount of bleeding. Nothing you need to be alarmed about. So if you've got a panty liner, bring it along. If you don't have a panty liner, ask your doctors if they have one. We carry panty liners in our clinic and we do offer you one after a pap smear to use so that you can leave the clinic comfortably. I like to share with you some tips and tricks to make your pap smears more comfortable for yourself, and I found this has worked beautifully for some of my patients. When the speculum is inserted into your vagina, it sometimes has to be pushed down quite low. So what can help is that if your bum is lifted up a little, so it takes the discomfort away. So a trick I use is to get your hands, have it do something, get your hands and have it just slipped underneath your bum on both sides, and that way your butt's lifted up. And in this position it's more comfortable. Then you can spread your legs open, keeping your feet together, and you stay in this position until the entire pap smear is over. Once it's over, fold your legs back, put your feet back down, remove your hands out. And that's it.